My name is Borna Bunakdapur and I'm a cognitive neurologist at Northwestern Medicine. Music intervention is when we use music for patients to treat their symptoms. If it's used by a board-certified music therapist, we call it music therapy. If we use it in a setting of a research and in collaboration with music therapists or music practitioners, we usually call it music intervention. In individuals with neurologic disease, we've seen that if they have a problem in some area of the brain, in many of them, the areas that are dedicated for music processing are undamaged. So we can use those unharmed areas of the brain that are related to music to help them recover some of the abilities they've lost. For example, if it's speech or if it's movement. In individuals with dementia, surprisingly, areas that are related to long-term music memories are intact until very advanced stages of the disease. So the person may not be communicate verbally, but if you play music for them or ask them to sing, they will wake up and then start participating in musical activities. And then we've shown that that can actually help with their mood, with their psychiatric manifestations, and it can calm them down, decrease their agitation, which really affect their quality of life. We've seen that, and we've shown that they can sustain some of those functions that they acquire through music therapy even after the music therapy is done. So, and that's really the goal. In individuals with dementia and in many neurologic diseases, if people have, for example, agitation or have symptoms that need to be treated with medications, we try not to use medications in the beginning because some of these medications have side effects. And so we try to avoid those and use non-pharmacological interventions like art therapy, like music therapy. And if we can help them with their irritability, with their aggressive behavior, violent behavior, or agitation, then we can save them those medications that can have side effects on heart, on other organs, and really reduces their life expectancy. So in the study the pilot study that we finished, we looked at 20 individuals with dementia and 10 individuals with dementia, so 20 individuals with dementia who actually received music therapy or music intervention, and 10 who didn't. What we showed was after 3 months of intervention, individuals who did receive the music intervention, they improved in terms of their neuropsychiatric symptoms like irritability, agitation, hallucination, depression, violent behavior. And then the people who did not receive the music intervention, they got worse over time. Their symptoms got worse. That's what happens, unfortunately, with dementias. We didn't really expect to rehabilitate their language or their ability to talk, but we definitely showed that there was an effect on nonverbal communication. And it really is life-changing for the family members because we had people, because of the disease, the actual relationship between the patient and the spouse or the partner, it really gets affected. What makes music special? Because there are so many different interventions. You can use art therapy, you can read poetry, but what is really specific for music that makes it specifically helpful? That's not what we really need to know better. The pathway from when we hear sound to the brainstem to the brain, if we can tap into those pathways and see what really happens that affects the brain, affects people's mood, that would be very interesting. And this is an area that really is open to investigation.